there certainly are, ADHD a lot of times does not exist by itself. A lot of times there are what we call comorbidities or coexisting conditions. Probably one of the most common ones is oppositional defiant disorder. And that is a disorder where there's a more pervasive oppositionality than you necessarily would see with just ADHD alone. They typically won't take direction from almost any authority figure and have a tendency to be fairly defiant. So there's about a 40 to 67% comorbidity of oppositional defiant disorder. A little bit more serious of a disorder is conduct disorder, and that's where they actually tend to kind of step over the societal norms and start actually doing some outright law breaking with conduct disorder. There's about a 20 to 56% comorbidity rate with that. With some of our mood disorders, major depression and bipolar disorder, depends on the studies, but with major depression, there's anywhere from 0 to 30%, depending on which study you look at. With bipolar disorder, 0 to 20%. One of the things that I do a lot of times try to get in my history taking is asking whether or not they've had any testing done through the school, because there is anywhere from 25 to 50% comorbid learning disabilities. So that's something that I'll encourage people to maybe take a look at as well, especially if there does seem to be some impairment with learning and acquisition of actual knowledge. So there has been some discussion in the literature about ADHD being what they call a disorder of executive functions. And I'll talk to my families about that. Our brain and our frontal cortex and prefrontal cortex, that's the main area of our brain that kind of helps us with attending to things, deciding what is important and what isn't. So, helping us stay on track, stay on task, not becoming distracted into things that are not important. It helps us with organization and deciding, triaging kind of what's important and what isn't. And a lot of times if they're taking a look, I think, a little bit more at that particular area of the brain. And a lot of our medicines actually tend to focus on improving, I guess, the function of that area of the brain. It's fairly rich in dopamine and norepinephrine, and a lot of our drugs, especially the stimulant medications, tend to increase the letdown of dopamine and or norepinephrine, depending on which stimulant you choose. And the stimulants generally are my first line of treatment for ADHD. They've been out there for a long time. They do have concerning side effects, but generally by the time most people get to me, they've already had some other interventions. If not, then sometimes I will suggest that maybe, especially if it's a younger child, that we look at doing some therapy first to see if we can get some things looked at and dealt with before we go to medication, because there are side effects to our medication. The stimulants, as some of you may know, can decrease appetite, increase heart rate, increase blood pressure. So they do have some impact more globally on the child than just improving their focus and concentration. And with anything, you're looking at your benefits versus your risks. But I think the stimulants have generally proven across the years to be very good at providing a good intervention. And they also tend to be fairly flexible and versatile because they don't stay in the system all the time. So if we do want to take a break on the weekends or when school's not in session, they're a little bit more amenable to that occurring. Strattera is also another drug that's out there. It's the only one that would probably be classified as a non-stimulant that has an indication for ADHD. So that's something that's an option as well. And you're going to, as a physician, you're going to tailor your treatment to the full history, so there are certainly some cases where I may go with that particular medication first. With different sorts of resources that I'll direct parents to, a lot of times, as many of you may know, this is going to affect a child in the classroom, so a lot of times I'll let parents know that they may want to have a conversation with their teacher. Some people want the school to know, some people don't, the majority do, and I will encourage them to get in touch with the teacher and let them know, that we are starting medication, because it's important for me as the prescribing doctor to get feedback from all the different sources that I can, so I can make the best decision about whether or not we need to continue with that medication, do we need to look at something else, and also there certainly are interventions within the classroom that can be made to help the student perform better. I don't necessarily make specific recommendations along those lines, but I think there are certainly lots of different resources out there that talk about some of the interventions that can be helpful with different students in the classroom. And some students need a little bit more intervention than others, because like any other disease or disorder we have, there's varying degrees of severity. So some people are much more mild and are able to compensate better than others. Some of the other resources that I'll talk to families about include these that or this particular one that Dave wrote up for me, the CHAD. They're a fairly large organization, children and adults with attention deficit disorders. And they generally have a lot of different literature that are available for people to use. And as families in Indiana are trying to figure out how to go about getting services for their children within the school, I'll also talk with them about Article 7, which is the Indiana law about Americans with disabilities, and kind of helps with moderating what interventions and when should be made by a school. And some schools are starting to categorize ADHD under otherwise health impaired. Some schools don't, and then in that case, that's when I would talk with them about a Section 504 plan that can be put into place, which also allows an individualized education plan to be made for the child. So that's really all I had to say. I know I threw a lot of information at you very quickly. But if you guys have any questions, please feel free.
You mentioned the stimulants. Strattera, I recognize. Ritalin, of course, is among the oldest drugs, I guess, for this kind of thing. But as far as the side effects, like the facial rash, tummy upset, loss of appetite, do these go away? Does the sufferer grow out of them?
Well, that varies from person to person, whether or not it'll go away or not. And I certainly have had some where we haven't been able to get that particular, like with the stomach pain. That's one that I'll hear about. And I'll generally hear that more as we have to go up on the dose. Sometimes on the lower doses, I don't hear about it, and then maybe they're not focusing and concentrating as well, so we have to do, or we decide to try and increase, and then I'll start hearing about some stomach pain and that. Typically, for the most part, I found that if I start low enough and I can get it into the person's system at a lower dose, then I generally am a little bit more successful at bypassing that.